Patients and their family members often ask me, what can we do to increase one's appetite? What can we do to help put some weight back on? In this follow-up video, I will be discussing the role of food and some of the strategies we have that may help improve your appetite. Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. Please see the welcome video of this channel for my declaration that I do not have any conflicts of interest or any financial sponsors, and for the medical legal disclaimer statements. In a previous video, we discussed the common reasons why patients with a serious illness can experience a loss of appetite and weight loss. We also discussed the invisible process called the Anorexia-Cachexia syndrome. If you haven't seen that video, I will leave a link in the description box below. In this video, let's first talk about the role of food. Food is much more than simply a source of nutrition. It is an important symbol of love and care, and is a valued part of many cultures around the world. What do I mean by this? Well, what do we do when we welcome a new neighbor or when we visit a friend or family member? We bring them food. What do we do when we celebrate or when we grieve? We share food. Although the food items and the rituals may vary, sharing food and eating together is a symbolic act that is deeply ingrained in many cultures around the world. And when we lose the ability to engage in this act, things can really feel out of place. In the setting of an advanced cancer or an organ illness, patients and their family members often ask, what can we do to improve the appetite? But before providing an answer, I would first ask the patient, how important is it to you that you are able to eat and have a desire to eat? How much does a low appetite bother you? Now, on the surface, these may sound like silly questions. In my experience, though, having a low appetite does not universally bother all patients to the same degree. There are patients where this is simply not a priority for them, or perhaps they have previously experienced that eating more causes them more symptoms. Furthermore, in some cultures, a loss of appetite and reduced intake is seen as a preparatory and inevitable part of the natural dying process. Given this, as healthcare providers, we must address the patient's unique set of needs and concerns, rather than just assume that what bothers one bothers all. But to address the topic of this video, however, let's say that the patient in question is indeed bothered by the fact that they don't feel like eating. They desire to participate in the eating process with their family, and they wish to gain some weight back. Let's first talk about some of the strategies that do not involve using medications. Number 1, engaging in light physical activity. Now, this does not need to be intensive activity. Even light physical activity can have a positive effect on a patient's mood and mind, and in turn, their appetite. This can also help preserve muscle mass and physical function. It is useful to involve a physiotherapist to tailor a specific plan that is both achievable and beneficial to that particular patient. Number 2, getting a dietitian to provide guidance. The goal here is to come up with a food plan that is more palatable while still optimizing nutrient-rich food. A dietitian can also advise on the texture of food in hopes of making it easier and less painful to eat. How your meals are scheduled can also have an impact, such as having several smaller meals throughout the day instead of the more typical 3 larger meals a day. Further to this point, it's totally okay to snack or graze throughout the day. Now, this may go against what some of us myself included, have been taught. But if you feel peckish, snack away. Number 3, make meals appear more visually appealing and more approachable. What do I mean by this? We all have different preferences, but I think we can all agree that fancy restaurants and Michelin-starred chefs pay a lot of attention to how a meal is plated. The visual presentation can really make or break the dining experience. So for me, this looks much more appetizing than this school cafeteria slop. So experiment with different colors, arrangements, and garnishes. Make it more appealing to you. Now, how can we make meals more approachable? Similar to the visual presentation, the quantity of food on the plate can also be highly influential on how appealing it looks. For instance, when we are not that hungry, having a smaller quantity of food well presented on the plate can be much more approachable than a heaping plate of food buffet style. It makes it seem more achievable rather than the instant turnoff of, "Oh, I'm never going to finish that." Number 4, for many patients who are ill, their sense of smell and taste is altered. These changes can affect the enjoyment of food and how well it is perceived. If this describes your situation, I encourage you to experiment with different flavor profiles, such as adding different sauces, adding flavored syrups to drinks, cutting bitter and metallic tastes by adding a little sugar, and cleansing the palate between meals with fruit flavors or sparkling water. Now, these are only a few examples, but the important point here is to tailor it to a patient's individual needs and desires. Sometimes, the odors produced from cooking can negatively affect one's appetite. If this is the case, even though it might be hard to achieve, perhaps considering cooking the food elsewhere or when the patient is not nearby. Number 5, encouragement to eat only for pleasure and not just for calories. Depending on how advanced the illness is, we may need to reprioritize what gets eaten. In earlier stages of illness, there may be a focus on calorie and nutrient-dense foods. But as we get closer to end of life, we may need to prioritize eating only for pleasure and only eating what is truly enjoyable. And number 6, when you're full, you're full. There should be no pressure to eat beyond this point. Now I realize that this is much easier said than done. As well, meal times can still be social and bonding times, even if not everyone is eating. It may feel awkward at first, but it's the time together that should be valued over what and how much you're eating. Are there medications that could stimulate one's appetite? We commonly get this question. In the setting of a serious illness, yes, there are. Although, how well they work is highly variable and dependent on many patient factors. So there's not a one-shoe-fits-all type of approach. As a disclaimer, even though I will be providing examples of medications, I am not directly endorsing the use of any of them. This discussion is for educational purposes only, so please ask the medical team most familiar with your unique situation whether any of these medications are appropriate for you. In general, a useful first step is to ask your doctor or your medical team to review the medications that you are currently taking. There are many medications whose side effects can directly affect one's appetite. By reviewing and streamlining your existing medications, hopefully side effects can be minimized. Let's now talk about medications that may help improve your appetite. We can start with one called olanzapine. There is new emerging evidence that a low dosage of this antipsychotic medication can be effective in increasing a cancer patient's appetite and may also be useful in treating the Anorexia-Cachexia syndrome. Increased hunger and food intake is one of the known side effects of olanzapine. So here, we are making good use of a known side effect. Olanzapine, through a different mechanism, is also effective for treating nausea. So in some patients, better nausea control can also have a role in improving their appetite. On the topic of nausea, there are pro-motility medications that can help propel food along your GI tract, making food exit the stomach and move through your bowels faster. When taken prior to eating, these might decrease the sensation of early fullness and may also help with controlling the sensation of nausea. One example of these pro-motility medications is domperidone. It won't directly stimulate your appetite per se, but it may allow you to eat more before feeling full. Corticosteroid medications, such as prednisone and dexamethasone, can also be used to stimulate one's appetite. This group of medications has an anti-inflammatory effect, so it may help dampen down the inflammation-inducing cytokine activity from the Anorexia-Cachexia syndrome. A known side effect of corticosteroid medications is increased hunger. So in this setting, we are again making good use of a known side effect. Any weight gain, however, typically results from fluid retention rather than from muscle building. Prolonged usage of corticosteroid medications has a very long list of potential problems, so best used on a short-term basis. What about other inflammation-reducing medications? Are we able to shut off the Anorexia-Cachexia syndrome? At time of filming, there is ongoing research looking into the usage of anti-inflammatory medications, such as ibuprofen, as well as omega-3 fatty acids found in fish oil. From the limited clinical trials to date, though, there might be potential here, but the results so far have not been practice-changing. Similarly, there are ongoing studies looking into specific hormones that would result in increased food intake, such as the hormone ghrelin. Early studies have shown that ghrelin might be useful for addressing the Anorexia-Cachexia syndrome in cancer patients, but it is still early days and is not yet in widespread use. Looking beyond pills from the pharmacy, the use of cannabis and marijuana has become much more popular lately due to the side effect of getting the munchies. It may also have a role in improving taste and smell perception, making food more palatable. It's the THC, or the tetrahydrocannabinol, that creates this sense of increased hunger. But some people do not like the dizziness, drowsiness, and the altered mental and perception states that can also come with THC. The use of these medications to stimulate one's appetite is off-label, meaning it was never the primary intention of the medication. More importantly, its effectiveness will vary across patients, and what works for one may not necessarily work for another. So please speak to the medical team most familiar with your situation for more guidance. To recap this video, we first discussed the role of food and how it might be symbolic beyond the calories. We then discussed some non-medicine interventions and strategies that might help increase one's appetite, such as engaging in light physical activity, involving a dietitian, making meals more approachable, changing flavor profiles, and encouragement to eat only for pleasure. If one is desiring medications to stimulate appetite, we discussed a few options from different medication classes where we are making good use of known side effects. But the usefulness and how well they work varies greatly. Thank you very much for watching this video. Please stay tuned for part 3 of the series for a discussion on the role of artificial nutrition. See you then.